Now let's discuss the formation of the electrical signal on an ECG readout. The cardiac baseline on an ECG is called the resting potential and is the baseline before any electrical activity occurs. Cardiac depolarization is the electrical activity which results in the movement of the cardiac muscles. This is sometimes called action potential and is fueled by the sodium-potassium pump. At rest, sodium and potassium are at their usual levels. There is rapid depolarization while sodium flows in and potassium flows out. This process is later reversed. The result is repolarization. In between depolarization and repolarization, there is an absolute refractory period, meaning a second action potential or electrical signal cannot cause an additional depolarization. Systole is the contraction of the heart muscle, and diastole is the relaxation or rest of the muscle. A normal heartbeat follows a PQRST pattern. P is the depolarization of the atriums, which should occur simultaneously. QRS is the depolarization of the ventricles, which are much larger and more powerful than the atrium. Because ventricular depolarization is more powerful, it covers the repolarization of the atrium on the ECG markings. Finally, the T wave represents repolarization of the ventricles. When measuring heart rhythms, several pieces are taken into account, starting with the PR interval, or the time it takes from the start of the P wave, or atrial contraction, to the start of the Q wave, or ventricle contraction. This time should be between 0.12 and 0.20 seconds, or 3 to 5 small squares. If the P wave is absent, a dysrhythmia is present. The QRS complex, or ventricular contraction, is known as either narrow or broad. Narrow QRS complexes are usually considered normal, while broad or wide complexes indicate cardiac damage or electrolyte imbalances. The QRS is labeled differently depending on if portions go above or below the isometric line. The next portion assessed is the ST segment, or the amount of time it takes for the ventricles to depolarize. It is measured using the J point, which should be evident at baseline regardless of the pattern in the QRS. It may be depressed or below the isometric line in patients who have oxygen deficits, or elevated in patients who have cardiac damage. ST elevation in 2 or more continuous leads may indicate a myocardial infarction. Finally, the T wave represents repolarization. This segment, known as the QT interval, may indicate a prolonged repolarization period. Patients with a prolonged QT are at risk for developing dangerous arrhythmias. The normal length is 0.36 to 0.44 seconds and may vary between male and female patients. A few patients may also have a U wave, which occurs after the T wave and represents repolarization of the Purkinje fibers. This wave may be normal in young athletes, but may indicate old myocardial infarction, exercise-induced ischemia, or even hypokalemia. Normal sinus rhythm is the term we use to discuss normal rhythms. This means the electrical signal initiates from the sinus node and follows the correct pathway through completion. There is a P wave for every QRS, and the PR interval is normal. The term sinus tachycardia or bradycardia is used for rhythms faster or slower than 60 to 100 beats per minute. This may be normal for the patient. Slow beats are common in young athletes, while fast beats are normal in people who are exercising or have greater metabolic needs. There is no need to intervene using ACLS protocols for patients in normal sinus rhythm. Continue to monitor and prevent worsening conditions. While it may be complicated, knowing what to look for in an ECG strip will help you identify dangerous rhythms and possibly prevent some complications.